Hello, I'm Paul Barr, Senior Writer for Hospitals and Health Networks magazine. Achieving clinical integration, a necessary component to preparing for the changes taking place in healthcare today, can require a major reworking of the operations at a hospital or health system. Nancy McClure, COO of HealthPartners, is here to tell us about the system's two-pronged approach in redesigning and rebuilding its clinical delivery models. Thank you for joining us, Nancy. Can you describe what you've done so far in terms of improving clinical integration?
Well, I think for us at HealthPartners, what we think about is when we want to achieve better results in healthcare, it's improved health of the population we served, better experience of care for every patient, and making healthcare more affordable, which we call the triple aim. And I think instead of thinking about how do we create a structure like an ACO to make that happen, what's important is to roll up our sleeves and work on both the culture in our system and the design of care to be able to produce those kind of triple aim results. And so that's what we've done, is work on both culture and care design.
What were some of the biggest challenges you've faced so far?
Well, I think that, first of all, it's just hard work and it doesn't happen overnight. So maybe that's a challenge, is being patient. I think knowing that you can't work on one or the other and have to work on both simultaneously is really important. If we try to change the work processes without working on what the basic culture is, there will be great resistance. And just working on culture without actually backing it up with better work processes doesn't work either.
How receptive were physicians to the changes you've been implementing or proposing?
Well, I think, as we talked about yesterday, it was important to have a good, lengthy dialogue with physicians about what the changes meant. And as we move from more of an autonomy-based model where every physician works the way they were trained in healthcare, and that leads to wide variation, there's a lot of, that's the current system, and a lot of people are used to that. And to paint a picture for the future that's not just that's going to go away, but we're going to make a better future together, takes a dialogue. Because what we get in a new future is more reliable care, better results for patients, and a more sustaining and satisfying practice for physicians. Because if we create some standardization, reliable processes, it means physicians can count on whoever their team member is that day providing care in the same way as someone else.
How important is it, or how big a role did the fact that you have your own health plan play in this process?
Being an organization that's both a health plan or financing system and a delivery system gives us the ability to look at the challenges and issues from a broader perspective. And so instead of coming to work and blaming health plans or financing systems or having the health plan blame the doctors, we actually just looked at how do we work together to solve the issues. And I think that was a big issue and a big advantage. I think the other thing is the ability to look at both data from our electronic record and from our claims system to identify opportunities, challenges, areas where we could improve is also a big advantage.
Finally, what are you looking ahead? What are you planning to do in this regard?
Well, I think this is a never-ending journey. When we look at what we've done, we spend more time looking ahead at what more is there to do. I think how we work with patients to really customize care to meet patient needs so that we're truly engaging people around their care, I think is the next big issue. I think there's a lot of one-size-fits-all in medicine where we want to tell patients what to do and then be annoyed if they don't adhere. And really, it should be much more about what do we do to engage patients to achieve the results that they want to achieve.
Thanks for talking with us today, Nancy. This is Paul Barr for Hospitals and Health Networks magazine. Thank you for watching.